Equipment that you will need when caring for a wet patient includes a capper, which is a type of respirator, the battery, an impermeable double shrouded hood, a filter cap, and the protective cover. You will also need a bouffant cap. This is helpful if you have very long hair to keep it out of the way. Purple plastic boot covers, light blue extended length nitrile gloves in your size, blue impermeable boot covers, dark blue extended length nitrile gloves in your size, a ViroGuard suit, and a plastic apron. The first step will be to remove any personal clothing or items. No personal items such as jewelry, rings, watches, cell phones, pagers, pens should be worn. Long hair should be tied up. Eyeglasses should be secured. Inspect PPE prior to donning. Visually inspect the PPE to ensure that it is in serviceable condition without tears or rips, that all PPE and supplies are available, and that the sizes selected are appropriate for the caregiver. With the ViroGuard suit, apply a zip tie if needed. Perform hand hygiene. Using an alcohol-based hand sanitizer, perform hand hygiene. Allow hands to dry before moving to the next step. Clip battery pack of capper to scrubs, cleanable belt, or place in pants pocket. Place the capper on head. Adjust the knob to fit. Tight enough that it does not move when leaning forward. Plug capper into battery. Turn fan speed up to high. Leave capper hood off at this time. Put on inner boot covers, purple impervious. The upper band of the boot cover will be worn under the pant leg of the coverall to prevent pooling of liquids between the coverall pant leg and upper band of the boot cover. Put on inner gloves. Put on the first pair of gloves, light blue, extended length nitrile gloves. Put on ViroGuard suit. Ensure the suit is large enough to allow unrestricted movement. Ensure the cuffs of the inner gloves are tucked under the sleeve of the suit. The hood can be left tucked in as well. Ensure the boot covers are tucked under the leg cuff of the suit. Put on outer boot covers. The outer boot covers are used to provide an extra layer of protection to the lower legs and feet. outer gloves. Put on a second pair of gloves, dark blue, extended length nitrile gloves. Ensure the gloves are pulled up over the sleeves of the VibraGuard suit. Put on capper hood. Have assistant assist with putting on the capper. Put on outer apron. Put an outer apron on to provide an additional layer of protection for the front of the body. You may need to stretch the neck of the apron to allow it to go over the capper. Your PPE assistant can assist you with tying if needed. Now we begin the doffing process for wet PPE. We will inspect the PPE for visible contamination, cuts, or tears before starting to remove. If any PPE is visibly contaminated, disinfect it by using a disinfectant wipe. Disinfect outer gloves. Disinfect outer glove hands and allow to fully dry. Remove apron. Grasp apron at chest and pull away from your body to break the neck and waist tie. Roll the apron away from you, containing the soiled outer surface as you roll. Discard apron upon taking care to avoid contaminating gloves or other surfaces. Inspect. After removing the apron, inspect your PPE for visible contamination. Disinfect and remove outer gloves. Disinfect outer gloves. Remove and discard outer gloves, taking care not to contaminate the inner gloves when removing the outer gloves. Dispose of outer gloves. Inspect and disinfect inner gloves. Inspect the inner gloves' outer surfaces for visible contamination, cuts, or tears. Prepare capper hood for removal. Untie chest of the capper and waist. Remove the tie by gently pulling and discard. Disinfect gloves. Gently roll up outer shroud of hood starting at the back, sides, then front. Secure front of shroud with tape. Remove viral guard suit. Remove and discard the suit by tilting the head back to reach the zip tie. Unzip the coverall completely before rolling down while turning inside out. Avoid contact with scrubs, outer surface of coverall during removal, touching only the inside of the coverall. Be sure that outer boot covers are removed during this step as well. Dispose of coverall and boot covers in designated waste bins. Disinfect inner gloves. Remove inner boot covers. Roll down and remove boot covers, taking care not to contaminate pant legs. Disinfect washable shoes. Using a disinfectant wipe, wipe every external surface of the shoe. Then place the clean feet on a clean area of the floor. Disinfect inner gloves. Remove capper. Wipe protective cap with disinfectant wipe. Then remove protective cap and place in a designated area for disinfection. Remove filter cover, starting in the back and rolling forward. Discard filter cover. Roll back of outer shroud forward and disconnect face shield from capper by pulling forward. Disinfect gloves. Remove capper and battery and place in designated area for disinfection. Disinfect and remove inner gloves. Disinfect inner gloves, remove and discard gloves, taking care not to contaminate bare hands during removal process, and dispose of inner gloves. Perform hand hygiene. If you used a bouffant cap, you would now remove it. Inspect. The caregiver and assistant should inspect for any contamination of the surgical scrubs. If there is contamination, shower immediately and report the breach to the site manager.